Hello, sweetie. How are you? I'm well. Oh, it's good to hear. Yeah, I know. Long time no see. It's been a busy year. It really has. Oh, I know. It has been just absolutely crazy. But I'm glad that you're in the clinic today. I'm glad we're gonna talk through just some skincare stuff. Sorry, it is so hot in here. I need to toss this hair up. But yeah, I'm glad that you came in today and we can just talk about kind of what you want to do with your skin, kind of just re-go over a consultation, talk about everything that's going on with you again, and just kind of catch up. Yeah. No, that's awesome. Okay. Well, I do still have your form here from last time, but of course you know me, I always want to be on the safe side. We're going to go through everything again. We're going to talk skin, we're going to talk treatment, procedure, post-care, all of it. I just want to, give you options today and see how you're feeling. Yeah, of course. Okay, well, I still, like I said, have all your information from last year, so I'm just going to pull that up. Okay. Well, yeah, then we can just jump right in. Yeah. Okay. Let's just start with tanning. I know since it is summer, everybody's got their tan going already. When was the last time you laid out in the sun? Perfect. And did you use your SPF? Of course. And then I know before we had you at a skin type 4 because you were seeing a little bit more sun when you guys were down in Florida. But since it is kind of the beginning of summer, I think we're going to put you at a skin type 3 if that's okay. I think we're going to see just a little bit more results from placing you at that skin type. Yeah, of course. And then would you say you always tan, rarely burn, or you rarely burn, always tan, or just somewhere kind of in the middle? Yeah, of course. Of course. And then when you are laying outside, what SPF are you using? Okay, awesome. You still have that one that I gave you? Okay, sounds good. Now, remind me again of your exact ethnicity. Perfect. And then remind me, are you on any photosensitive medications? Oh, yeah. Okay. And then, I know this one, but are you pregnant or breastfeeding? Okay. How are the kids, by the way? Good. Oh, I know everybody's getting so old on us. Oh, it's hard. It's hard to see them go. Okay, and then I know last time we had talked that you might have gotten a metal implant. Do you have that yet? Okay. And where is that? The knee. Okay. Sounds good. Okay, now I think, honestly, that's the major stuff. We can just jump right into just talking about your skincare. Yeah. Okay. So if you just kind of want to walk me through what your skincare routine looks like, that would be awesome. Okay. And how many times are you cleansing a day? Twice. Beautiful. And then your next step. Okay. And then that toner, are you using it morning and night? Okay. You've got it down. Okay. Yeah. Okay, let's go over that night routine. Like you said, you're already cleansing. And then, okay, and then what peptide is that? Okay, B3. and then you use your retinol at night, and then again. How many days has it been since you last used that retinol? Oh, you're perfect. You already knew. Okay, sounds good. All right. Well, it all looks great. I do, obviously, I'm going to get on you about using your SPF this summer because I know you guys like to go out on the boat, but I think you're headed in the right direction, and I think maybe just talking through our options today is key. Yeah. Okay. I think we should head down the path of an IPL. That IPL laser treatment is going to target those age spots, sunspots. It's going to target all of those reds you dislike, the discoloration around the nose, the mouth, in the cheeks, while simultaneously still targeting that pigment. Yeah. Okay. Yeah, so an IPL, if you were going to say how long does it quote unquote last, well, it's going to last as well as you're taking care of it. And we can get into that more a little bit later with the post-care, but typically we'd like to say that your skin will look its very best after about a week to 10 days. And then if you continue to wear your sunscreen, use your medical grade cleanser, your toners, your serums, your vitamin C, your retinols, your skin will maintain that look. I mean, I know you're so good about all of your skincare steps, but if we really do decide to do an IPL, the commitment to sunscreen does have to increase. Yeah. I mean, we can talk more about what sunscreens you should be using, especially after this treatment. It's so important. Yeah, of course. So, basically the way IPL works is it targets the pigment in our skin. So, I'm going to get a little close to you so you can see. But do you see how there's kind of just a buildup of excess pigment on my driving side? I've got a large mole here, a large mole here, and then you just kind of see some freckling, just right there. But on this side, you barely see any. And it's simply just from driving. Just all of that time I spend in my car. As much as car companies would love to say that their cars keep out UVA and UVB, they don't. Our windows do not unfortunately keep out UVA or UVB, so it is really our job to wear our sunscreen, make sure our skin is moisturized, we're wearing a hat, we're wearing sunglasses, and that's the best we can do. I know you're pretty good about wearing your hat. SPF, I love Revision. It's my favorite skincare line there is. Truly, it is so moisturizing, and if you do have overly oily skin, it doesn't add oil to it. It almost just leaves like a matte powdery finish. Yeah. And another great thing with Revision is that they have the IntelliShade SPF, and so that one is going to match the color of your face as soon as it goes on. Yeah. It's definitely nice when you want a little bit extra color, but you don't have it. So I would say that might be your best bet after this treatment. But yeah, basically the way IPL works is the laser is looking for pigment. When I set your skin tone at a skin type 3, we're saying, okay, your skin has this characteristic, that characteristic. I'm looking at your hair color, I'm looking at your eye color, just to see where I can place you on that Fitzpatrick scale. Yeah, pretty much. Yeah. And then after that, as soon as we get the laser going, I'm going to basically do one pass going this way and then do a pass going that way. That ensures that we're just getting all of that pigment. We're going to treat deep first, and then we're going to work up to the shallow layer of the skin. Yeah, so the reason we start treating the skin at a deeper level is just because we can see everything with the naked eye that is laying on the surface of our skin, but we can't unfortunately see the pigment that still has yet to rise. And we want to get ahead of that and get on that. If we treat at a deep level, we're instantly hitting that top layer, that middle layer, and we're penetrating all the way to that third layer of skin to prevent any excess pigment from rising to the surface. Yeah. No, I know. It is pretty cool. Yeah. Do you have any other questions about kind of how it works? I would say your skin shouldn't be dry or red afterwards at all. If anything, the most annoying part about an IPL is that excess pigment we were talking about that you find in your skin, you will notice it will get darker the next couple of days, unfortunately. So we want it to rise to the surface and basically fall off of our skin. Yeah. Exactly. Then treating reds is a little bit different. So if we want to treat those broken capillaries around your nose and your chin, I think with that we're going to go in with the vascular filter. And the vascular filter is going to just really target those broken capillaries and shut down the vessel so you don't have those tiny little spider veins. That one, they pretty much go away instantly. It's not like the pigment where it kind of rises to the surface. This is basically like you walk out of here, gone. They are dormant, they are shut off, they are gone. Yeah. Okay, so we for sure want to do the veins. Okay, I'm going to put that down. For sure, do the veins. And did you want to treat your rosacea at all? It's kind of similar. I will say that one you might leave here a little bit more red compared to the veins. Yeah, no, we can do the rosacea as well. Yep, it's the same treatment. It doesn't cost any extra. This is basically a photofacial, so it's just treating everything on the face all at once. Of course. Okay. And how are you feeling about your pigment? Is that your main concern, or are you more concerned about the reds and the rosacea? It's still a pretty big concern. Yeah, of course. Okay. Well, what questions can I answer that will just kind of put you at ease and make you feel a little bit better about this treatment? There's no downtime. You can put makeup on 12 hours after your treatment, so we recommend coming in maybe for an appointment at 1 to 6 p.m. By the next morning, you can already put makeup on over. I know, it definitely helps. You shouldn't have anything really inflamed on your skin or super red. It should just be pretty in and out procedure. Yeah. Okay, so yeah, downtime isn't bad. I know you were kind of concerned because you have that wedding coming up. Okay. And then for post-care, that is where it does get a little bit more, we have to talk. Yeah, I know you're great about your skincare, but I know SPF is kind of difficult for you to just get in the routine of putting it on, keeping it on every day. If you're going on the boat, if you're going outside, put SPF on, put a hat on, get your sunglasses on. It will save you in the long run. Okay. We like to talk about it kind of as the ABCs, and C is your commitment. How committed are you to this treatment plan? Because I can sit here all day long and tell you the benefits and the post-care and all of the different treatments we offer, but if you aren't committed to wearing your sunscreen, doing your homework and post-care, then unfortunately results will not be maximized. Okay. Yeah. You think so? Okay. I think if you did do the IntelliShade SPF, I think it would benefit you because you could still have that color on your skin, and it's almost like a foundation, but it's an SPF, and it doesn't leave you feeling like you have anything on. If anything, it just feels like a moisturizer. Yeah. Okay, I will put in an order for that for you, and I can get it at cost, so don't worry. I'm not going to upcharge that for you. I will just get it at cost, and you can just Venmo me or whatever you want to do. No, I'm sure it's fine. It is okay. Okay. Well, I think that's about it. All of your consent forms are filled out. We talked through your skincare. I know you have a good regimen. If we can just really get you wearing your SPF every single day, you'll be golden. Okay. Do you want to look at dates? Yeah, okay. So it looks like next week I am pretty open on Wednesday the 7th and Friday the 9th. Do the weekends work well? Oh, I forgot. You guys go up to your cabin. Okay. Wednesday? Yeah. Okay. Wednesday the 7th. Do we want to do an early appointment or do we want to do more mid-afternoon? Okay. I'll put you down for 1. And if you need to move it, we can get it rescheduled. I will say if you can try to stay out of the sun this weekend and next weekend after being up at the lake, it will definitely improve your results. Okay. Well, I have all of your forms filled out and you are all set. I think that's it. If you have any more questions for me, just let me know. I can answer absolutely anything, but just keep me updated, and it was so good to see you today. I'm so glad you came in. Now, we are going to get your skin on the right track. We're going to get rid of those reds. We're going to get rid of that pigment. We'll clear up that rosacea. Yeah. Of course. All right. Well, you have a good rest of your day. I will see you on the 7th at 1 p.m. Okay. Bye-bye.